Many patients do experience mild symptoms for weeks or even months before a heart attack. Think of it like a car's check engine light. Your body may be quietly signaling that something needs attention.
In the next few minutes, we'll highlight 5 common early clues: unusual fatigue, chest pressure, breathlessness, sleep troubles, and referred pain that often show up long before a major heart event. These symptoms can be subtle, so we'll use everyday analogies to explain them. Remember, none of this replaces medical advice, but knowing what to watch for could literally save your life. Unusual, lasting fatigue. Feeling exhausted for no obvious reason? Fatigue is one of the most common early signs of a heart attack. You might wake up after a full night's sleep and still feel wiped out, like your phone battery is stuck at 10% no matter how much you recharge. For example, everyday tasks, walking, climbing stairs, doing groceries, suddenly leave you breathless and drained, even if you've been healthy. Why does heart trouble cause fatigue? When a coronary artery is narrowing, your heart must work much harder to pump blood. Less oxygen-rich blood reaches your muscles and organs, so everything feels like a marathon. Experts have found that about 70% of women who later had a heart attack reported new, unexplained fatigue beforehand. This is sometimes called cardiac fatigue. In general, studies show up to half of all heart attack patients notice unusual tiredness in the weeks before their event. If you find yourself persistently tired and off, despite normal sleep, diet, and activity, listen to that signal. It could be your heart asking for help. Chest discomfort, pressure, or heaviness. Chest symptoms are the classic warning sign, but they often don't feel like a sudden stab of pain. Instead, many people describe a vague pressure or tightness. Cardiologists emphasize that a heartache can feel like squeezing, fullness, or heaviness, not sharp pain. Imagine someone gently pressing on your chest with a heavy book. It's uncomfortable, maybe dull, and it may come and go. Studies confirm this. In heart attack survivors, a large majority report chest pressure present before a heart attack. For instance, one hospital study found chest pain or heaviness accounted for about 68% of early heart attack symptoms. Likewise, medical guides note that chest discomfort is one of the most common signs of a heart attack, often radiating into the arms, neck, jaw, or back. Often this pressure shows up with exertion, like climbing stairs, and eases with rest, similar to how a traffic jam builds and clears on a busy highway. Don't wait for dramatic, movie-style pain. If you feel a new, unexplained pressure or squeezing in your chest, especially during activity and relieved by rest, take it seriously. The American Heart Association advises calling emergency services if any chest discomfort lasts more than a few minutes. Early evaluation can prevent a traffic jam in your heart arteries from becoming a medical emergency. Shortness of breath with or without activity. Shortness of breath, feeling like you can't catch your breath, is another red flag. We all get winded after a sprint or a long flight of stairs, but new or worsening breathlessness is unusual. Data suggest this is fairly common before a heart attack. In one study of women, about 42% reported unexplained shortness of breath in the month leading up to their heart attack. Broadly, roughly 40–50% of all patients have prodromal breathlessness. Sometimes this breathing difficulty happens even without chest pain. So if you're suddenly more winded than usual, say a brisk walk or a flight of stairs leaves you unusually breathless, or you have to stop and gasp, don't just chalk it up to age or being out of shape. It could be a warning sign to check in with your doctor. Unusual sleep disturbances. New or severe sleep problems may also hint at heart issues. Of course, everyone has a rough night sometimes, but listen for patterns. Waking up gasping for air, or feeling like you can't sleep flat without discomfort. For example, you might suddenly need extra pillows to prop yourself up, or wake up in the middle of the night feeling short of breath. Remarkably, up to half of heart attack patients, especially women, report new sleep problems in the weeks before their heart attack. These are nights not disturbed by stress or snoring, but by breathlessness or unexplained discomfort. The fluid buildup in lung tissue can make every breath a chore when you lie down. If you find yourself restless at night, needing more pillows, or waking suddenly feeling like you can't breathe, and this isn't due to other known causes, it's worth mentioning to a healthcare provider. Your heart never takes a break, even at 3 a.m., so pay attention to its nighttime signals. Referred pain: neck, jaw, back, arm. Although we usually think of heart pain in the chest, the heart can whisper pain elsewhere in the body, a phenomenon called referred pain. Think of your nerves as electrical wires. A short circuit in your heart can make other parts of the body hurt. Common spots include the neck, jaw, shoulders, arms, especially the left, and upper back. For example, you might feel an odd dull ache or pressure in your jaw or between your shoulder blades that comes and goes. People sometimes dismiss it as a stiff neck or indigestion, but it can be your heart signaling distress. This is especially noted in women, but it happens to men too. Health experts point out that pain in the arms, back, neck, or jaw can indeed be a heart symptom. In fact, studies show many heart attack patients, particularly women, reported unusual pain in these areas before their heart attack. If you have a new unexplained ache in your neck, jaw, shoulder, or back, and it's not clearly from exercise, injury, or dental issues, consider that it might be cardiac in origin. Better safe than sorry. Mention it to a doctor even if your chest feels fine.
To recap, 5 key warning signs can whisper at you weeks or months before a heart attack. Unexplained fatigue, feeling consistently drained despite adequate rest. Chest discomfort, new pressure, squeezing, or fullness in the chest. Shortness of breath, getting winded easily or breathless at rest. Sleep issues, waking breathless or needing extra pillows to breathe comfortably. Pain elsewhere, aches in the neck, jaw, shoulders, arms, or back without other cause. If symptoms are new, worsening, or just feeling off, talk with a healthcare provider. As one expert notes, any potential heart-related symptom warrants prompt attention. Knowledge is power. Share these insights with friends and family. By paying attention to subtle clues, you could be the hero who prevents the next heart attack. Remember, a heart attack usually doesn't strike out of the blue, and by listening to your body's whispers, you can act before it ever shouts. Stay informed, stay vigilant. This is not medical advice. If you notice these symptoms, consult your doctor. This information is for awareness only. Always seek advice from a healthcare provider. Have questions? Check out www.doctor-nad.com. If you notice any of these symptoms, consult your doctor. Take care of your health, and remember to like, subscribe, and share to help others.